Good morning, everybody, and thank you for coming to the session, and so quickly as well. I know we're running a little over. My name is Dianne Zalitis. I do work at Health Direct. I'm a practicing midwife as well, and I work as the clinical lead looking after our pregnancy, birth and baby service. But today, in our session this morning, I'm talking to you about Teachback. As the title says, a telephone communication technique that we trial to improve our caller understanding of health information. Sorry, I have to reach to my right to change the slides. So this morning I just want to talk a little bit about what Teachback is and how it might be relevant to you in primary health practice. I'll talk a little bit about our study and the findings and some of the implications for practice. And at the very last slide we'll have my contacts and information for you so you can get those down. That worked? Good. Okay, so telehealth. I just want to talk a little bit about what some of the benefits and challenges are. So telehealth for people who work in that space, it requires quite advanced communication skills because you're not seeing the person that you're talking to, and so you need those skills to compensate for the lack of visual cues that you get from people in communication. It can be very difficult to identify low health literacy levels. Language, certainly skills you can, but their health literacy levels can be harder to identify. And our pregnancy, birth and baby service is provided entirely by telehealth, so we don't have any or very little face-to-face contact. Telehealth can be a very effective and efficient way to provide health information to people, and it certainly overcomes barriers that people have in accessing health information, such as distance, having to travel. And you can provide really high quality health information in a convenient way for the user. But, and there's always a but, as we know, 55% of our communication relies on visual and non-verbal cues, so people's facial expressions and all of that type of stuff that we pick up when we communicate, but we don't perhaps even realise we're doing it. And the words that we speak are only form about 17% of the communication. So there's a lot more comes when you see people. And so because of that, how do we know where the caller or the patient has really understood and comprehended the information that we're trying to get across to them? And then the value of your service does then come into question if your caller forgets or they actually misunderstand the information. Now, and of course then there is a significant inability for people to actually accurately recall information, and other studies have shown that 40 to 80% of information is either forgotten straight away or remembered incorrectly. And that's more pronounced over the phone when you're providing health information over the phone. And some of these studies have found that parents will typically remember a child's diagnosis, but they will really struggle to remember treatment protocols or actions to follow up with. So what is Teachback? So Teachback is, in its simplest, it's an interactive communication loop, and its basic steps require us as providers to invite our clients, our callers, into the conversation rather than it being a didactic kind of lecture that we can kind of fall back into doing quite easily. And we ask them to explain back in their own words the information they've received as part of the conversation. And then you can add and clarify anything that they've misremembered or have misunderstood. And certainly from our experience, parents, especially our new and expecting parents, often call us, and you may well find as well in your practice, and when people come for health advice, they're often in distress situations, they're really worried about something, and they may not always understand what the information advice means, and they often don't feel comfortable about asking questions to clarify. Often it's enough that they come to ask for help, but then to go, well, I didn't really understand what you're talking about, is really a challenge for some people. So our Teachback pilot was aimed to improve outcomes for our families by ensuring that our callers really did understand the information that we're giving out to them. And we did that by getting them to say the information back to us in their own words. There were some challenges even in doing that. Okay. Teachback as a tool, as a communication tool, is recommended as it supports child health outcomes because it improves parents' comprehension of the information, and it's very frequently used over the phone between health professionals to make sure everybody's on the same page. It's not used a lot in consumer phone services. It's used a lot in face-to-face services, and again, one of the key features is that the onus of ensuring the caller's understanding relies with us as the health professional, not with them. So it's really on us to make sure that they've understood and know what to do next. Okay, so before I go into the findings, just what is pregnancy, birth and baby in the service and where we ran this trial. So our pregnancy, birth and baby service provides services to all expecting and new parents. It's a national service, it's funded by the Commonwealth Government, it's free, it's 7 days a week from 7 a.m. till midnight. We have maternal child health nurses who answer the phone, and a counselling service as well. We use the telephone, we use the video, although we have very low uptake on that, but that's a talk for another time. A website and Facebook forum, so we predominantly interact with our 35,000 callers a year via a telehealth mode. And just basically, the maternal child health nurses answer the phone. We do a warm transfer, and I put in brackets what that means because someone said to me, Dianne, people don't know what you mean by warm and cold. So we transfer to counsellors involve a clinical handover. We also transfer to all the nurse triage lines in the country for people who actually have an unwell child or they're unwell themselves for a triage call. And then we refer them back out to local services for ongoing care. And it's just basically I guess for your background, the scope of our service, advice and guidance on anything from pregnancy, infant, child health, nutrition, breastfeeding. We do a lot of breastfeeding, sleep. We get a lot of calls from day 3 at home and that first 6 weeks with feeding, settling, but still also into parenting, toilet training, toddler issues, tantrums, like all of that challenging stuff. So what we wanted to know, so we ran a 6-week, yes please come in, there's seats up the front. I won't be upset if you walk through. I actually have a room full of people now. When I came at 11 it was empty. I thought, this will be fun, I'll talk to myself for 20 minutes. So what we wanted to know, we ran a 6-week randomised controlled trial with Sydney University, and we were looking at some main outcomes, so the caller understanding of the content, that they knew what to do next, how long our calls lasted for, which is actually kind of really important when you want to provide as many calls as you can to people, so we have some KPIs, key metrics around that. So our call length is limited on average to 10 minutes, and that includes the interaction with the caller and then your paperwork that you have to do at the end of that. That the caller and the nurses were satisfied with that encounter, that it actually helped and not made it worse. So, what we did, just very briefly on how we did this, I won't go too deeply into this, but we ran training for the nurses first, and we began that with some self-reflection on whether they actually did Teachback, and then explained to them what Teachback was, and then they very quickly realised that they weren't doing Teachback. Often we think we do, and we ask questions around, do people understand this? But often our questions are closed, so they inspire a yes or a no response, and mostly we're going to get yes because people want to be nice to us. They don't want to kind of say no back to you because they think they're being rude to their nurse and it's going to upset you and they're wasting their time. We had a control group of callers so we could compare the different outcomes, and we had focus groups and then follow-up interviews with callers to really look at how this worked from their perspective. So, just watching my clock. Some of the results that we got. Okay, so in changing practice from the nurse's perspective, one of the things that came out really clearly was that they weren't doing Teachback. And this was a nurse's quote, it was all about teach, give them as much information, but not teaching back. And it really confirmed that they all had a lack of prior knowledge and experience with this. We did self-reflection, or they did self-reflection, I should say, all the way through. And this is a really typical quote. The client showed me that they understood my instructions, and that helped me to feel more confident that the information I'm conveying is coming across accurately. They described prior to the Teachback workshops that they used communication techniques like active listening, confirming understanding, and asking for clarification, but not actually using this model. But they all noted that they were never really sure if the caller really understood what to do next, or if they would even follow through. Okay. So some of our findings from the training. The nurses found self-reflection a really helpful tool for learning Teachback, and so they would do their self-reflection at the end of every call, and I'll talk a little bit more about that a bit later. And they also talked to each other, so debriefed, so they learned from their own experiences and their colleagues and how they implemented this into practice. They all wanted more examples on how to do it with people on the phone, and they found that practicing with one or two phrases was better than trying to learn a list. We provided them with a list of phrases that they could choose from, and they chose the ones that kind of felt the most comfortable for themselves to use. They all found that it helped them to really assess caller engagement, and it removed the assumption that their caller just understood straight away, so they actually had some evidence. I thought it was really good to know whether the person on the end of the phone really understood the information I was giving out, and it made me feel more confident that I was explaining things and they could understand and actually relay it back to them. And so while they thought they were doing this really well, once they actually started doing it, it was rather an exciting step forward for them to really know that people were getting it right. Another really interesting finding that we had was the medico-legal safety aspect, because it significantly reduced the chances that the callers misunderstood the information. And I guess from that perspective is the risk that they will do something that's actually going to harm themselves. And they're able to evaluate really then how well they convey the information. And in this instance, it does give you the opportunity to reinforce what you said, because, and we always had the caller's name, didn't have it all right, but she got most of it right. So you just then have to clarify the bit that they don't quite have. Caller experiences. Yeah. All the callers found it really helpful, and they got off the phone feeling a lot more confident about what to do next. This is one caller I was actually very pleased. It was something the nurse had done. I found it a very useful tactic generally. We also found some callers will naturally teach back. They will enter into that conversation with you and just clarify that they've got it. And you don't then need to do anything different in that situation. Once you're aware of what Teachback is, you can hear that in the conversation and know where you're at. And all the callers seem to appreciate it. And what I've got in brackets, so the calls were listened to, so we ran this over 6 weeks, so in the early stages it sounds kind of awkward to listen to till people get into the flow of doing it. And then it becomes a lot more natural. Okay, so from a service provision perspective, the findings, we found that Teachback is really useful for any situation that needs like a multi-step teaching, so you want people to do this and then this. If you have action plans that you've drawn up with people or developed, it's really good for running through that. For confirming with them when they're going to seek further advice. So for all of our callers, we will give them when they need to call us back or who they need to go to next, and just to reaffirm that they know that. But also calming highly anxious callers. So like I said, we have a lot of new parents. Sometimes they ring us on day 2 or 3, babies on day 2 or 3, and they're at home and they're really anxious, and the anxiety doesn't really drop for some time. So in calming them down and then getting to the issue at hand that they need dealt with. But we also found that there are situations where may not be suitable. Again, if people are doing it naturally, and for us, if our callers, if they need to attend to their child quickly, so if continuing in this fashion is going to either extend the call or delay what they need to do. And our nurses use their professional judgment around what callers was inappropriate to use this kind of technique with. They might need a more directive, do this, and they move on to that one step. I haven't had my 5-minute flag. I must be talking really fast, am I, Nicole? Yeah, sorry. Okay, implementing into practice. So, a couple of the key things that we found was self-reflection is a really important thing to do, and to do it properly at the end of each call. So to take the time to actually reflect on what happened in that call. Did the caller really understand? How did I go with actually asking those questions and initiating the conversation in that style? And jotting that down. That made a big difference to getting it into practice. But also doing that before and then after we did the training. So it really raises the nurses' awareness of how they communicate with people on the phone. And then afterwards. During the initial learning, finding a couple of phrases that work, that feel natural to speak. So we did lots of role play stuff as well. So on the phone or actually in the room, and we had our people sitting with their backs to each other, so it was like they're on the phone, they couldn't see their face. So when you're doing the role play, well, if you're doing it in a face-to-face situation, it's good, but if you're on the phone, you don't want to bring the face into it because it actually changes the whole dynamic. But doing lots of, just practice using it when it's really a new style, to just make it sound more natural for yourself, and then it's more natural for your caller and the person that you're talking to. We also provided real-life workplace examples. So all of our calls are recorded, unless people ask us not to do that. So we're able to listen to how everybody actually does this. And so the nurses are able to listen to each other's calls and go, oh, well, that was a style I liked, I'll try that. And creating opportunities for debriefing and discussing and reflecting among the nurses in the team. All right. And now I'm at my last slide. So I did go really kind of fast. So we do have, I've just put the links to our website. We actually also do Facebook forums, which I've spoken about here previously. We have an exhibition booth in the hall, so come and talk to me if you want to know more about this. And there's my email address, and I do have business cards if you haven't got time to scribble that down. But we have a minute or two for questions if you'd like to ask me any, otherwise I'll get off so we can keep going and get to lunch. Eventually. Sorry. Don't leave the microphone.
Hi, my name's Emily. I am from Brisbane, North PHN, and we've had the introduction of healthcare homes in some of our practices in that region. I think that this could be a really helpful technique for some of the nurses that are working in that space. Where or how do they go about learning the techniques that you've sort of developed or are using?
Okay, so there are. I can give you sort of some of the information around how we have done that, and maybe we can chat afterwards a bit more. There isn't anywhere I can kind of direct you to. So we did this in partnership with Sydney University, and they did part of the training, and we also had somebody from Melbourne who had used it in face-to-face practice in pharmacies that run the training. But come and chat to me. I can give you some of those contacts to do that, and we also might be able to help you with that as well. I know we do. The company, Health Direct Australia, does a lot of work with PHNs. Yeah.
We probably have time for one more question. Any more questions? Thanks very much, Dianne.
Thank you. I'm not sure how we get back. I'll leave that up there. I'll let you sort how to get back. Thank you, guys.